Welcome to DC2B Revolution. I'm your host, Noah Volz, and this is where I'm helping chiropractic students think big in order to live large. Today, I'm here with Dr. Dino Pappas, and he's a chiropractic physician, certified athletic trainer, certified strength and conditioning specialist. He's got a lot more certifications than just that. That's a small snapshot, so lots to be learned from him. And he was in Illinois, recently moved to Austin, Texas. I'm sure the state of Texas is lucky to have somebody with your qualifications, especially when it comes to conservative orthopedic care, sports medicine, soft tissue management, rehab. So Dr. Dino, thanks so much for coming on the show.
Thanks for having me on. I appreciate the intro. That's it's way too flattering, man. Thank you.
Yeah, no, my pleasure. I love all the posts that you do on Facebook, and you're such a great educator. So I'm really excited to have you today, and specifically wanted to talk about. I know you did a talk at Logan College called "The Transition from Clinic to Clinical Practice and Organizing Your Toolbox." So I kind of wanted to do a nutshell version of that and see what you have found to be the secrets in clinical practice, because you graduated in, I think, 2009, but you've had a really successful practice since then. So I wonder if you could kind of share what you've learned along the way, and especially in that transition.
Yeah, it's an interesting thing. You go from the proverbial saying, you go from the frying pan and into the fire. So there is no one roadmap to transition to clinical practice. Everybody's path is just a little bit different. And trying to figure out the right situation and the right place for you to be is always challenging, and it has to be an individualistic decision. There's the clinical, which there's a lot of questions on, and there's the life advice, which people have even more questions on. So if I can help your viewers out in any way, shape, or form, whether it's during this interview or after the interview, I have no problems with people calling, texting me, and email me. You alluded to one of the things that I did after about 4 to 5 years in practice. I went back to my chiropractic school that I graduated from, and I ended up doing a presentation called 4 years later, and 5 years later, and then 6 years later. And basically, part of it was how do you organize your toolbox to get rapid results and reproducible results so you can get them over and over and over and over again, and know where you failed. Sometimes you'll fail on a case and you don't know where. You're scratching your head. You're thinking to yourself, where did I go wrong? And also some life advice, things I wished I learned, because we're all going to make mistakes, but you should never make a mistake that you can't recover from, especially early in your career. And that was the name of the presentation you alluded to.
Yeah, thank you. So, there's a lot there for us. So, in terms of the clinical skills, I mean, of course, we get clinical skills in chiropractic school, and many of those are really valuable and necessary. Did you feel adequately prepared when you got out of school, or were there kind of additional trainings or additional things you did to develop the clinical skills so that when you had those complex cases that you didn't know how to treat, you had some more options?
I was fortunate because I worked as an athletic trainer in outpatient physical therapy, and I had a sports medicine background. So the orthopedic skill set that commonly falls into, and rehabilitation that commonly falls into a traditional chiropractic practice, I had a knowledge and a baseline. But the more I got into chiropractic school, the more I realized, even though I had this baseline knowledge, I still had so many more questions than I did answers. So I felt like I had a good foundation, but I needed to take a step up. And the first thing I did was identify really good mentors. I'm going to plug my mentors here. They really molded me. Dr. Thomas Lotus in Chicago, Tom Lotus, very sharp guy, very passionate about patient care. You get that in the first couple seconds when you talk to him. Dr. Brett Winchester, he was part of MPI. He's taught all over the world. And just sitting there and listening to them, I took Dr. Winchester's class at Logan 3 times. I sat through his class. And not because I failed. It's just because I had a block in the schedule and I wanted to hear it a second time. And there's a saying, education is getting it right the second time, not the first time. First time, you kind of have that fallacy. All right, I get it, but you don't. And kind of sitting through their courses and listening to them and their passion about patient care kind of helped mold me into what I am today. And the hardest thing for a young chiropractor like yourself, you're going to learn this technique or that technique and soft tissue and rehab and how to integrate that in a comprehensive system. And one of the things that helped me organize that toolbox and shrink that toolbox down that I gave a lot of credit to from Dr. Winchester and especially Dr. Tom Lotus was the McKenzie Method. That sits at the core of how I evaluate and assess a patient and classify, so I can get the best approach in the shortest amount of time and reproducible results. It's the scientific method applied to patient care. And from that, I branch off into different tools and techniques from that. But that's really sits classification and assessment is the core of which how I feel patients should be treated in the office and how they should progress.
Yeah, thank you so much for sharing that. Because exactly like you said, being in clinic myself right now, I feel like I have all of these different pieces, but I don't know how to put them all together, and I don't know how to take somebody from that assessment management, figure out, 90% of the time things work, but that 10% of the time where things aren't working. And then I don't have any way to kind of backtrack and figure out what I did wrong or what I need to do differently or anything like that. So I feel like that's really, really valuable information for people to have. Are there other kind of tools that you use in your toolbox that, assist you when maybe that method leads you in a certain direction that you may not normally go?
Yeah, so one of the misconceptions about the McKenzie Method, one of the misconceptions out there that it's just a set of exercises. People namely think it's extension or it's flexion, but the reality it's a system. It's a system of evaluation, and it's getting the relevant information to putting that into a concise format so you can process that and apply the right treatment, whether it's hands-on manual therapy, and when is that needed? Because we go at it backwards. We start with the most force that we can. We start with manipulation, whereas we want patients to be active. We want patients to take ownership of the situation. So shouldn't we start with exercise first and then eventually progress into more passive things if we need to? It's kind of a different model than chiropractic, where we're told to manipulate first and ask questions later. So the method is based on a scientific method where you form a hypothesis and you assess it, and you prove it right, you prove it wrong. And either way, you get information. And because it's viewed as an assessment first, it's a great way of knowing where you failed along the lines. And then you take another step in another direction. And they're doing research about this in Chicago at the Rehab Institute of Chicago. And namely, Dr. Lotus has alluded to this. The people at RIC have talked about classifying the pain mechanism. What is the pain driver? Is it tissue nociception? Is it centrally mediated pain? Is it from the peripheral nervous system? Is it from the autonomic nervous system? Because if you can classify the pain mechanism, and if you can classify what the patient is, or what they have, or what condition is going on, more likely than not, you'll be able to apply the right strategy. And that's where the beauty is. It leads you right down the path of where you need to be. And if you failed, all right, I have a hypothesis, I have the information, let me test another hypothesis. The scientific method applied to healthcare. That's the beauty of it.
Yeah, I mean, that's awesome. And I'm so glad there's a method out there. I wish that I was learning a little bit more of that in school, but I know that school really is just a opportunity for me to pass my boards and then move on. So I'm excited about that. As you were talking, I couldn't help but think about this clinical skill set that you've developed. And I feel like, as a burgeoning chiropractor, there's so many paths that I can take. There's so many types of chiropractic that I can practice. And so, if I'm just curious from you, like, what do you see as the future of chiropractic? And if you could, give me advice on which direction to take in terms of the type of chiropractor that I've become, what would your recommendations be?
Keep it simple. What are you passionate about, right? Like, what gets you up in the morning and keeps you up late at night, right? Because you're going to attract that crowd over time that you want to see in your office. It's interesting because my wife, who I practiced with for years when we were in Illinois before we moved to Austin, Texas, does functional and integrated medicine. That's what she's passionate about. That's her baby. That's her joy. So you know what? That's what she's good at, and that's what she should do. She shouldn't practice the traditional musculoskeletal care or sports medicine in a wide manner. I'm passionate about sports medicine, orthopedic injuries, and that's how I want to structure my practice. So you can't fake it. You can't, do with it. It can't be a money thing. You're in it for the wrong reasons if that's the case. The first thing, let's flip this back on you. Noah, what are you passionate about? What keeps you up late at night, gets you out of bed first thing in the morning? That's how you should structure your practice. You're unique. You're special. That's exactly what you should do. All right. Everybody's a little bit different. The second part, there's a part B to that question. Okay, so we flip this to Noah. Now let's flip this back into what's available and what's out there. There was a study done in like 2005, and it asked to predict what would be the future of the chiropractic profession. And it came up with 4 scenarios. The first scenario is chiropractors would do what they've always done, restrict practice to mostly manipulation. Not only do they do mostly manipulation, but the traditional doc in a box model, one doctor, one office, does manipulation, passes them off to somebody else, extended treatment plans. And they predicted that over time that model would go belly up. The healthcare system was changing. It was looking for different solutions. And although that's the past of chiropractic, that would not be the future. And even the great Carol Levitt said that if chiropractic restricted itself only to thrust manipulation, it would go the way of the dinosaur. And this guy is the godfather of manual medicine in the United States, is what we know it. The second thing, they found room for chiropractors to grow into the area of comprehensive, integrated neuromusculoskeletal care. So you being the point of access for neuromusculoskeletal and orthopedic and rehabilitation injuries, or you being the point of contact for entry level into conservative spine care. And there's going to be a growing demand of that because of the opioid crisis and because of the way of evidence-based medicine and cost-effective outcomes are playing. We're seeing cost reduction with soft tissue injuries and conservative care by utilizing a chiropractor, by utilizing a physical therapist, by keeping them out of the orthopedist office when they do not need to be in the orthopedist office. So that was scenario number 2. The scenario number 3 was chiropractors becoming the wellness life doctors. Not my words, their words. So becoming better equipped to be a PCP, a primary care physician, as long as your scope provides it, taking a blood pressure, learning how to conservatively manage diabetes, helping the patient navigate the healthcare spectrum, which there is a huge shortage of PCPs across the United States, especially in underserved area. And the last thing was growth in geriatric care because the American population is aging. Unfortunately, that has to deal a lot with the Medicare model, which I don't also feel is sustainable. So if you're looking for growth, what are you passionate about? And the 2 most logical and plausible scenarios are being the conservative soft tissue and rehab expert, either in spine or for any other joint-based problems, along with being the conservative primary care physician, because many people do not have that.
Yeah, and I'm in complete agreement with you there. And as some of my other guests have said, they've said the time has never been better for chiropractors wanting to do conservative spine care in that kind of interdisciplinary, multidisciplinary environment. Just like you said, with the opioid epidemic and with low back pain at an epic high, there's so many opportunities for that kind of practice model to thrive. What do you feel like I can do as a student, or what students can do right now? Let's say they have a year, 2 years left in school to kind of hone that skill set and prepare themselves to be, as successful as possible once they get out of clinic and into their actual clinical practice.
First is what I mentioned, just find some good mentors, people that you know, like, and trust, people they're talked about very highly and respected in the industry. My mentors, Dr. Winchester and Dr. Lotus, I shadowed them several times, and it really kind of set the tone for me to like, crap, I'm not as good as what I thought. I still have a ways to go. And you know what, if I can just get at least from them how passionate they are about helping people first, I'll be somewhat successful. So finding really good mentors is a good place in the right direction. Second, if you're thinking about going into an integrative strategy, start setting up your professional network wherever you want to go. If you want to stay in the Bay Area, I know you're out in the Bay Area of California. If you want to go back to Oregon, I know you mentioned that you're originally from Colorado. Get back. Call up the primary care physicians. Call up the orthopedists. Call up the neurosurgeons and say, you know what, my name is Noah Volz. I'm a chiropractic student. but you know what? I need to grow my professional network because I want to be able to find good people to refer to, and getting your foot on the door to see what the other half does, because I guarantee you they have no clue what a good, legitimate, evidence-based chiropractor does. They have not been exposed to it. Likewise, you've never been exposed to neurosurgery or orthopedic surgery, or my personal favorite is physiatry. I have great relationships with several physiatrists. Why? Because when they stop, I begin, and when I stop, they begin, and it's synergy. So getting that opportunity to expose yourself to what the other community does is really a great way to grow you as a professional, set up those networks, and make references so that you can get a job and have an integrative setting, whether it's actually what you do or having that good referral network.
Yeah, I mean, I have a good friend in Oregon who's a chiropractor, and he said that the thing that built his practice the most was offering to take other allied health professionals out to lunch. And not everybody wanted to go out to lunch and spend that much time with him, but just the offer created a relationship, created a conversation. And so when when they needed a chiropractor, they would send him to him, and it developed, that relationship started to develop. And through those relationships, he started to learn from them, they started to learn from him, and it's been a really good synergy for him, from there on out. So I think that's really great advice, just getting out there and putting yourself out there, and
the common misconception that people make is when they get into private practice and they want to set up integrative relationships with medical providers in the area and acupuncturists and massage therapists, they're looking for too many. You're looking for a couple, because all you're looking for is the quality. And the quality is you have a relationship based off of communication and concern for the patient. And hopefully it turns into a good business relationship, because you want to send your patients to the best in that area. And the best in that area respect what you do, listen to what you do, and will exchange patients, exchange information, communication. So rather than looking for 20 neurosurgeons, find one or two. Rather than looking for 20 orthopedists, find one or two. And really hone that relationship. So your friends alluded to it, but find the one or two good docs in your area, because those are the ones that you're going to build your practice and your reputation and help you. They'll make you look good, and you will make them look good at some point in your career too. It's a synergy. It's a beautiful synergy to have.
Yeah, I love it. It's, like that quote, you're the average of the 5 people you spend the most time with. I mean, similar in your clinical practice, you're the average of the 5 people that you refer to. And so if you're referring to the best and you're part of that network, then, by default,
they'll bring you up.
The best. Yeah.
Yeah.
Exactly. We've talked a lot about, the different systems and methods to use in terms of your clinical practice, also the mentorship aspect, and how important that is. I'm curious to hear from you about your clinical skills. We're talking about this transition from clinic, and we've talked about kind of the nuts and bolts of, different methods to utilize to assess and analyze. I feel like there's also this really important psychosocial aspect and almost like personal development aspect of becoming a doctor and developing trust and developing rapport with your patients. Can you talk to students a little bit about that, and how you've worked with that?
Yeah, that's an underestimated part of being in clinical practice is the patient relationship. Doctors, by what they say, how they dress, how they act, how they carry themselves, can either induce hurt, harm, or actually can facilitate healing. So that's an underappreciated aspect. And what you say makes a difference in the prognosis and the outcome. For that patient, you have to remember that's the first time they could be experiencing something, and they're scared. They're scared because they don't know. They don't know that this back pain is mostly like the flu. You have episodes and bouts, and you get over them. So when they have the second or third episode, oh my God, I'm going to be crippled, I'm going to be disabled. And real quickly, you have to find strategies in clinical practice to disarm that. Tell them the truth and put a positive spin on that without losing your audience. And that's an art. They don't teach that in chiropractic school. They don't teach that in medical school. And really, it's just being empathetic, recognizing that you don't have all the answers all the time, being honest, and just plugging away at it one day, one patient at a time. And people don't tell you this in the medical world. They don't tell you this. I don't know, but I'm going to find out is often a very good answer, because it's the truthful answer and people can respect that. And you're human just like they are. So yeah, the psychosocial component is definitely underappreciated. There's some little tricks that you learn over time, again, by having good mentors or using the right outcome assessment to realize there is a psychosocial issue at play that needs to be dealt with. That's dealt with in that book that I referred to called A World of Hurt. Again, the info came from the Rehab Institute of Chicago with some outstanding providers down there. The outcome assessment's always been there for multiple years, but the clinical art and the clinical practice and refining what you say to a patient does make a huge difference. Be empathetic when you get out of school. Recognize you don't have all the answers, and do your best to close those gaps down.
Yeah, thank you. I mean, that's, when I interviewed Dr. Bobby Maybe, he talked about that a lot. And, just like, kind of like you said with the McKenzie method, it's almost using the scientific method with your communication. What aspects of your communication are really working? What are you noticing that people really respond to? And, kind of continually refining that process. You strike me as somebody who's really good at that. You have this system, but you also are constantly reassessing, reevaluating, looking at what works, looking at the research, all of that. I wonder if you could kind of walk through your process for that, so that a student can kind of learn from how you, integrate new information, synthesize that information, bring that to the patient, decide whether that's, relevant or helpful. Can you kind of give us a snapshot into your mind and how you do that?
Yeah, so my initial, like anybody, it's a comprehensive evaluation, a comprehensive assessment. And basically you're asking the question, the 5 questions patients come with for the most part. Patients, what do I have? How long is this going to take? What's the relative cost to me going to be? Is this something that I'm going to have to learn to live with? And the last major questions that patients have, what are the potential complications that can occur if I come with treatment? So the evaluation that I have is basically answer those questions first and foremost for the patient. And the first thing they do when they walk in after I introduce myself, I'll say to them is, I am here for you. There's only one person in this room. I have to get it right, and that person is not speaking right now. It's you. So at any point in time, please ask me any question, because could be the first time you're hearing this. And doctors, I say it exactly like this. We take it for granted because we have this body of information, and we can flip from patient mode to doctor mode very quickly and lose you. And I don't want that to happen. Are you okay with that, Mr. Jones or Mrs. Jones? And they look at me and they're like, wow, this is actually somebody that's going to listen to me and answer all my questions. Yeah. And at the end of it, here's my cell phone. Feel free to text message me. Feel free to email me, because I need to get this right for you. So giving yourself accessibility to that patient is critical, I feel, to gaining their trust. Then I move into my mechanical assessment. What's going on? How do I classify the patient? And then you have this switch somewhere in there where you're getting out of the pain realm and you're transitioning them to what their goals are. And that's a key piece of the history. Is there anything that this is keeping you from doing that impacts the quality of your life? That transition comes for me somewhere between 3 to 5 visits from pain to performance. Performance isn't necessarily like CrossFit. I'm gonna deadlift 400 pounds, or I'm gonna be the world's strongest man, or anything like that. It's, can you pick up your baby? It's, can you play recreational basketball? It's, can I go down a flight of stairs without winded? And after we transition that pain to performance, that's for me where the fun goes, because I have a strength training and conditioning background. That's when you move into the SFMA for me, the FMS. That's when you transition into other level. But at the baseline, it's concern for a human being, rule out red flags, comprehensive examination, mechanical assessment, going up the layer, movement screening, performance screening up on top, and sports-specific screening up on the top. And I see it as a pyramid. And that's kind of how I layer my information. But without that concern and care, everything doesn't matter.
Yeah, perfect. I love how you did that kind of pyramid and looked at, the foundational aspects and are able to, move up. I know there's a big movement in chiropractic, at least at my school and probably at a lot of other schools, of, getting patients on these long-term care plans, and providing them lifelong care and support. I really like how you layered this pyramid, and that may only be relevant for a certain demographic of patients who has a very specific, athletic performance goal that they're trying to achieve. And, so finding out what the actual goal of that person is, and, facilitating that through the care seems, like a really great strategy.
There's an interesting little part to this. Before we get on this conference call, I'm actually writing a blog now for the Illinois Chiropractic Society, and it's lifetime care versus lifetime treatment. And here's what I mean. I'm an advocate of lifetime care. I am not an advocate of lifetime treatment. And it's surprising probably hearing this, and there is a difference. I want to earn your trust. I want to earn your trust so that 2 years from now, if you tear your rotator cuff and you need surgery, or you tear your ACL, you'll come to me and ask me for a referral. Who's the best knee specialist in town? That's lifetime care. You came to me first for that information. Or you hurt your back 4 or 5 years from now after I released you from care. You're coming to me first because you know, like, and trust me. Earning that trust, building that relationship. I want that lifetime care, that lifelong relationship. I don't want to treat you forever, but I want to care for you forever. And there is a difference with that. It may be 5 years from now, you're coming to me and you're asking me, hey, doctor recommended, because I'm borderline high blood pressure, to be on this blood pressure medication. What do you think? And I'll say to you, you know what? I have a really good personal trainer. We know that diet and exercise strategies, and I have a good nutritionist. I'm going to refer you to the nutritionist for the nutritional piece. I'm going to refer you to the personal trainer for the exercise piece. I want you to follow up with me in 3 months, and then in 6 months, we're going to check your blood pressure again. And we're going to do it when you're in a relaxed state, not white coat syndrome, where you come on in, you're stressed out, I got the white coat on, your blood pressure goes up. So I actually advocate for lifetime care, not lifetime treatment. There is a difference. I want to earn your trust with that relationship. So yeah, a little tidbit, kind of an interesting little thing, because I'm actually in the process of writing this article right now.
Yeah, such an important article, I think, especially for students, as we're trying to sift through all the information and figure out what really resonates with us. And, with the huge debt burden that we're under, average chiropractic student coming out of school with $242,000 worth of, debt at a 7% interest, it's a difficult place to make really good decisions. And so that's why I'm so grateful that you came on the show and kind of offer your, clinical gems, offer a lot of those pieces of how to make that transition into a practice that will really thrive, so that, that debt's not it's still a burden, but it's much less of a burden when you actually have a really successful practice. So appreciate, your input there. I know that there's going to be a lot of, students, maybe even other chiropractors, who watch this interview and are going to want more information about you, about your practice, about the things that you have found to be really helpful. What's the best way for them to get in touch with you, learn more about what you're doing?
I'm active on social media, so you can find me on Facebook at it's Dino Pappas, Dino, Pappas. I have a Twitter. It's at Dr. Dino Pappas, at Dr. Dino Pappas. There are some YouTube videos that I posted on our old practice page. We used to be in Illinois. The practice was called the Center for Integrated Medicine. So the THECFIM. I also give my email address out, and my email address is it's Dino Pappas, Dino Pappas at gmail.com. You can message me, you can email me. I'm more than happy to respond. I like you, I had a lot of questions, and I'm very fortunate that I had great mentors. And if I can give back to somebody, please let me know, because I want to see this profession do well. I want to see you do well, and I want to see other students do well.
Yeah. Thank you so much. And that's really, why I'm here as well. I really want this profession to thrive. I want students to have the information that they need in order to create, the practice of their dreams. So, thank you. And thank you to everybody who's watching the DC2B Revolution YouTube channel, helping chiropractic students think big to live large. Dr. Dino Pappas, it was a real pleasure. Thanks for coming on today.
Thanks, Noah. And I just want to say kudos to you, because I wish I had something like this when I graduated chiropractic school in 2009. Man, you're doing a great thing, brother. Keep it up.
Oh yeah, thank you. I love doing it. I love hanging out with people like you. So I really appreciate the feedback.